Hey everyone, welcome back to another episode. I'm really excited today. As you know, it's May. It's Food Allergy Awareness Month and Allergy Awareness Month in general. And I'm really excited because I get to speak with a fellow physician, a fellow Nebraskan who is an allergy expert, Dr. Jill Hanson. She is an allergist at Boystown in Omaha, Nebraska, and we're going to be talking all about food allergies and all of the confusion that surrounds those. So, Dr. Hanson, thank you for being with us today. I would love if we could start. And how did you choose allergy and immunology to go into as a field? Because there's so many different choices out there, and you picked allergy, and you seem to really like it and enjoy your practice from the shared patients that we have and talking with you previously. So, what made you pick allergy?
Yeah, it's a good question. I knew I wanted to do pediatrics pretty early on, so I had decided that for my residency choice, early in medical school, and then I kind of narrowed it down to a couple subspecialties. I kind of knew I wanted to have like a niche area that I could be just really dive deep into the individual conditions and just really know it well. And allergy stood out to me a lot because I think we have the opportunity to really make a huge impact on patients' lives. I mean, I see asthma, I see food allergies, seasonal allergies, medication allergies, and a lot of that is really satisfying to take care of because you can do so much to help improve just day-to-day life. There's so many medications out there that we can use to control asthma, control allergies. Food allergy is a tough one because there's not necessarily a cure, but I think there's a lot of opportunity just for education and talking with families about their concerns and, how do we help them? And although it's not something we can necessarily make go away, we can still help them cope and manage and live their lives day to day. So that's what I liked most about it. I think the other thing too is I like to see patients back again, and so still have some
Right.
continuity, not necessarily just like a one-time visit. No, I never see you again. And so that's kind of nice in allergy asthma as well. It's you get that continuity at least once a year, sometimes twice a year, we get to see people back. So that's fun.
I like that too, and I imagine that usually, the natural history of a lot of these allergies, like we're going to talk about today, is that for the vast majority, that things improve over time, and you can just help improve things faster or fill in a lot of those educational gaps or figuring out if it's a true allergy or something along those lines. I'm sure there's a lot of investigative work that goes into it too, and figuring out exactly what's going on.
Yes. Yes, absolutely. And I would say that's most true of food allergy. I mean, it's such a complicated issue when you talk about food allergy versus intolerance and, all the issues about early introduction nowadays. There is a lot to talk about. And it is sort of like a puzzle or a mystery sometimes, which I enjoy. So
Well, let's talk a little bit more about that because I think it's really confusing for parents to know what's going on. And I'll take the kind of prototypical example that I see is, well, there's a few different prototypical examples, but the one that I'm going to pick on first is in the younger babies and the concern where they're fussy a lot, where they spit up. Maybe they have green poop or brown poop or yellow poop or seedy poop or unseedy poop or kind of
mhm.
a mishmash of symptoms that seem to indicate that the baby is not, something's not right, and the parents are concerned. Is this a food allergy? Is this milk in
Right.
particular or soy in particular? Can you talk a little bit about like that idea of the milk protein intolerance, milk soy protein intolerance versus like milk allergy and how one would go about differentiating those or what a parent could look for?
Yeah, for sure, for sure. So, I think the most important distinction there is, and a lot of it comes down to terminology. I mean, I think when doctors talk about allergy, we're kind of referring specifically to like an anaphylactic allergy. So, the baby or the child has a food, they quickly break out in hives or have coughing or wheezing, swelling, difficulty breathing. Vomiting potentially can be part of that. So there are some
Hmm.
overlap in symptoms, but that's classically what we're talking about when we say milk allergy.
Okay.
And the intolerance more so, I mean, those are tricky because honestly, there's this huge sort of spectrum of reactions that people can have to foods, and the minority of it is actually anaphylactic. but that's what we kind of have the best understanding of and what we have the best testing for. And so
Right.
really it's a minority of patients, unfortunately, that we have really good testing to evaluate this kind of stuff. The intolerances can be incredibly frustrating, just because a lot of it is trial and error and things like that. But typically with the milk protein intolerance or, other food intolerances, a lot of times it is more intestinal symptoms. So, stomach upset, spitting up, diarrhea, funky looking stools, like you mentioned. I mean, I think that tends to be more typical of an intolerance type picture, versus true allergy, where you tend to see more of those kind of immediate symptoms within an hour for sure, within 2 hours maybe at the most. And it's typically more rashes and respiratory symptoms like coughing and wheezing and even repetitive sneezing or things like that. But it is sometimes very hard to differentiate. But I would say the other thing about allergy is that it's really, really unusual. And I don't want to say impossible because there's always exceptions, but it's very unusual for infants to react in a true allergic way when they themselves are not introducing the foods. So if it's mom and they're breastfeeding and they're getting some food protein passed through the breast milk, that can trigger intolerance type reactions, but it's exceedingly rare for that to actually trigger a true food allergy type reaction.
Gotcha.
So for example, like kids who have a peanut allergy, anaphylactic peanut allergy, even severe peanut allergies, their mothers can actually eat peanut in their diet and breastfeed, and it does not cause reaction. So there's some differences there too, as far as how it's triggered. And so, if I'm seeing a young infant that has never actually themselves drank milk, that's almost right away we can say, okay, this is not truly a milk allergy. We're probably dealing with more of an intolerance type issue, only because the body just recognizes that protein a little bit differently. And it's interestingly a little bit less sensitive to the breast milk proteins from an allergy standpoint. So long-winded answer to your question,
No,
but
that's helpful.
those are some of the things I think about. But
what I'm hearing is when we talk about allergy versus intolerance, allergy in the strictest sense is we get more than just the spitting up or the fussiness or the diarrhea or something like that. There's usually respiratory symptoms. There's usually sometimes vomiting, often rashes that go along with that. And there's a time correlation. So
definitely.
it's not, 2 days later we break out in a rash. It's within an hour, within 2 hours, where we have these immediate sort of noticeable symptoms.
Yeah, for sure. Yeah, for sure.
Okay.
And I think, the intolerance part of it oftentimes is more intestinal. I mean, we
Sure.
will also sometimes see some skin type reactions with that as well. Eczema is kind of a classic example of that, where,
Right.
Is this food potentially flaring the eczema? And that is also not necessarily an allergy per se. It's more of an intolerance to that food or a sensitivity to that food. But typically it is delayed. It's like, well, it doesn't happen right after they eat. It's more later that day or the next day, or just in general, having the food in the diet maybe flares the skin. That is much more consistent with an intolerance than a true allergy.
So if their eczema flares a few days after they eat something, then that would still be more of an intolerance issue rather than specifically food allergy driven. If it's food allergy driven, what I'm hearing is it's within an hour, within 2 hours, and that is what you would see if it was a true food allergy.
Yep, for sure. Yep. Yeah. And there's always some exceptions to that rule, but
Sure.
I would say vast majority of the time it's pretty immediate and recognizable and repetitive very consistently. I mean, if you truly have a food allergy, you're going to react to that food consistently every time.
Gotcha.
And so that's another thing that's actually differentiates between allergy versus intolerance. Is a lot of times intolerances tend to be a little bit more gray, a little bit more vague, where it's like, well, gosh, we think it's this food, but we're just not 100% sure. I mean, allergies, like we know it's this food. Every time
Right.
this food is given, we have this reaction. It's very consistent. It's very repetitive. It's usually not a, sort of a mystery or gray area to figure out.
Right. That's been my experience too. Is if parents aren't really sure, then oftentimes we don't find much. But if they say we
Hmm.
gave them scrambled eggs and then 20
Yep.
minutes later they were vomiting and had
Yep.
a rash, or we gave them peanut butter and then anaphylactic like symptoms, it's like okay, well people can put those things together. But if it's like, well, last week I think maybe we had some food that was made with peanut oil. It was like a week ago. I can't remember. Like,
Hmm.
okay, well that's not going
Yep.
to be the answer to the question necessarily.
Yep.
Um,
Right.
a question that just came to mind was a lot of parents fear, we've talked on other recent episodes with other allergists about the early introduction of
Hmm.
foods that are more likely to be allergic inducing. So things like peanut and egg and things like that. And there's a lot of parents that worry about that first time that they're going to give them
Hmm.
peanut. Um, if they've never had peanut before and mom's been either breastfeeding or formula feeding and eating or not eating peanut butter in their diet, either way, is there a risk with the very first exposure for anaphylaxis?
There is a risk, but it is
Okay.
exceedingly low.
Okay.
So these guidelines came out, gosh, I think it was 2016. So it's been
Hmm.
about 5 years now that there was a big push for this early introduction, specifically in the US. I mean, other countries
Right.
have been doing that for a while, but so we've got a pretty good track record of data, and I'm not aware of, a single case of first introduction to an infant where they actually had an anaphylactic reaction. I mean, I
Okay.
think the risk overall of a reaction is low. The risk of a severe reaction is really low. So,
Okay.
I mean, that first time, I mean, it is nerve wracking as a parent, but I think really overall it is very low risk.
Okay.
And I think too, the guidelines kind of incorporate risk to begin with. So if the child is at higher risk of a food allergy, if they have an existing food allergy already, or if they have really severe eczema, those kids are considered to be at higher risk and they should be
Right.
evaluated before they introduce the foods. And so, if we're talking about just sort of the general population of kids that don't have a food allergy, that don't have severe eczema, maybe they have eczema and it's mild or it's moderate, or they don't have eczema at all, those kids are really at exceedingly low risk.
Okay.
It's theoretically possible, but it's exceedingly low risk that you would see an
Gotcha.
anaphylactic reaction that very first time. So I try to emphasize that with them, when we're talking about this. And I think I always try to also have conversations about sort of risk versus benefit, pros versus cons kind of thing.
Right.
And once we sort of discuss that, I think a lot of parents feel a little better about it because the benefits are so substantial. I mean,
Right.
the LEAP study is sort of the famous one that documented essentially that early introduction reduces the risk of peanut allergy in particular is in that study. But it's about an 86% reduction in risk of peanut allergy if you introduce at 4 to 6 months of age, which is incredible.
Right.
There's not a lot of treatments that have those sorts of numbers, and so I think, really, I try to sort of give parents that confidence and feel empowered. Like, wow, I'm really doing something super important for my child. I'm feeling nervous about it. It is a little bit scary, but the benefits are so substantial and the risks are so minimal. It's just absolutely the right thing to do.
Well, and I think that that helps to frame the conversation because, this past year or two, we've really had a lot of risk benefit discussions in all of healthcare. And you
Absolutely.
look at the exceedingly rare risk in a kid that is already low risk. So somebody that doesn't have severe allergies or already has other food allergies that have been identified, there's the risk is really low of introducing, peanut at home and peanut butter in a puree or however you want to introduce it. There's the benefits that come with preventing allergy, and there's also the risk avoidance of if we don't introduce this because we're too worried,
Definitely.
well, then we could be
Yep.
setting them up for a peanut allergy in 3 months from now or 6 months from now because we didn't do that, in the timely fashion in the
Yep.
window that is recommended to introduce it. So I
Yep.
think that that's
Absolutely.
a good conversation that parents can understand is there's risks of
Yeah.
doing everything. There's risks of coming to the doctor's
Yes.
office versus staying at
Yes.
home, but we're gonna
Yep.
weigh these benefits and risks and make the best decision that
Yep.
we can have with the information that we have.
Yep, yep, for sure. And I'm glad you brought up that point about the risk of delaying because that also is significant. And that's definitely kind of going back to the earlier discussion about the intolerances.
Sure.
That's something that factors into that conversation, in my opinion as well. So, with those intolerances being a little bit more vague and difficult to figure out without having a lot of great testing to offer, I mean, I think that definitely requires a lot of ongoing discussion between the provider and the family. Like, if we're suspicious of a food and we want to take it out of the diet, okay, we can try that, but it should really be on a limited basis. Ideally, as few foods as possible for as short a period of time to really get a sense for does this help or not. And if it doesn't help, then by all means try to get that food back in the diet because that avoidance, could potentially lead to concerns down the road and certainly increasing the risk of food allergy potentially. So, I mean, I think that's something I always talk about too is, like you said, there are downsides to avoiding the food. So let's make
Right.
sure that we have a really good reason to avoid it. So that's another factor kind of in those intolerance discussions as well. And for the eczema piece of it too. I mean, I think
Right.
the data on eczema is pretty weak as far as foods triggering eczema.
Mm.
There are some cases of that, but a lot of the studies I've seen quote like maybe 5 or 10% of kids with eczema are actually triggered by a food.
Interesting. Okay.
Usually
So quite low.
yeah, very low. They're usually triggered by things like weather changes, temperature changes, fragrances, perfumes, and soaps and lotions, detergents. I mean, it's possible that it's allergy triggered, more specifically like dog allergy or cat allergy or dust mite. But the food allergy piece of it is really not a significant contributor as far as triggering eczema.
Gotcha.
And so I see a lot of kids that are avoiding foods because they are concerned that that particular food might flare the eczema. Which if there is a concern about that, it's not to say that it's not necessarily worth a trial to see if
Right.
taking that food out of the diet improves the eczema, but it should definitely be on a limited basis, ideally one food at a time, with the goal of trying to reintroduce it if there's not really a difference seen in the skin. Because those eczema patients are actually at higher risk than the general population of having a food allergy. And if we delay introduction or we withhold that food from their diet, actually we're increasing their risk of developing a food allergy. So we may be
Mm.
causing more harm actually than good. So that's another really complicated conversation that I try to have with those families too that are dealing with eczema because it is an incredibly frustrating condition. I mean, eczema
Oh, for
just is
sure.
enough to drive you crazy. It's like the skincare regimen, the triggers that sometimes you have no control over, like weather and temperature, humidity, things like that. And it would just be nice if we could say, oh, take this food out of your diet and the eczema will go away. But that's just not reality in the vast majority of cases. And so yeah, I think certainly thinking about those downsides is always important.
Well, and I like that too. I like, if we're going to do some sort of food elimination, and sometimes it comes up in the first 6 months of life, especially with moms,
Mhm.
with
Yep.
these intolerances, and is this causing it? Then I always like to put end dates on. If I'm like, yeah,
Mhm.
we've tried all these other things, it could be that they're getting upset or intolerant of the milk protein. So it would be fine to try, a few weeks off of dairy for yourself and your diet. But I
Yeah.
don't want you to just cut it out from your diet for the next year because that could
Mhm.
interfere with the longevity of breastfeeding. That could interfere with the enjoyment of parenting if we're, restricting our diet so much. That
Yes.
we always put an end date on it and say, then I want, if it works, great, but I still want you to try and reintroduce it
Mhm.
into your diet to see if it comes right back with your child, and then we'll have more information on whether or not that's the case, rather than just, okay, until you're done breastfeeding, you can't have ice cream or
Yep.
yogurt or cheese or
Yep.
soy or
Yep.
whatever it might be.
Yeah, absolutely. And I think that's just a really, really hard situation. And I'm sure you see
Right.
these poor moms too. And it's just, they're trying to do the right thing for their kid. And I feel like they'll do whatever they have to do. And I mean, I've seen, like, thinking of a mom that I saw recently, and it's like she was eating maybe three different meats and a handful of vegetables, and like that's
Yeah.
all she was eating. And it was kind of unclear as to whether it was really helping the child or not. The kiddo was still having some GI distress and spitting up and intestinal issues
Sure.
and things. And it's like, oh my gosh, I mean, this is not good for anyone. You're so
Mm-hmm.
stressed. You're starving.
Yeah.
Your diet is not nutritious. I mean, this breast milk that you're providing your child does not necessarily have everything it needs, and you're not
Right.
feeling well because you're not getting the
Right.
calories you need. So, I mean, I think it is a really sensitive topic because I feel like those moms are just sometimes making themselves martyrs, honestly, in a way. Like,
Sure.
I will do anything for my child, and which of course we do, but sometimes they're just really struggling and they're afraid to give up or afraid to introduce those foods because they think it's going to cause their child harm. And I mean, it's really tough. I mean, it's a really tough issue. And again, the testing is not helpful in those situations,
Sure.
which is also frustrating, where we can't really do a test and say, nope, we know that food's not the issue. We know this food is the issue. It's just all this kind of trial and error. So I think just really close follow up is important so that we're not spending months and months on an overly restrictive diet. Because, like you said, it does sometimes end up shortening that period of time that they're able to breastfeed,
Right.
understandably so.
Right.
So yeah, just that close follow up, I think, is so important.
And I think one thing that helps is, you being able to educate and set those expectations with the family too of this might work, this might not work. And either way, we know your child is thriving and growing. Yes, they spit up a lot. Yes, they have these skin complaints and things like that. We might not figure out what's going on and they will outgrow it. And it's really tough right now, but it might be something that we just have to tolerate. Again, the risk benefit ratio of doing everything versus doing nothing. It
Yep.
is a difficult thing to balance. And like you said, follow up makes it so much easier to know,
Yep.
yes, we might not solve this today. We might not solve this week, but we can come back and talk again in another couple of weeks and figure out how things are going or what else we could try.
Yeah, for sure, for sure. Yeah, and I think too the other thing, and I'm sure you see this a ton. I mean, the internet is such a a love hate kind of thing. I mean,
Right.
there's so many good resources out there and so much good information, and but there's also I feel like in this particular group of patients too, like these kids that are dealing with kind of these intolerance type symptoms. There's a lot of blogs out there and a lot of
Sure.
just parent boards and things like that. And I feel like sometimes it's just tough and it's hard to know where to go
Sure.
for good information. But that's again why that close follow up I think is so important, because there's a lot of misinformation out there. And I think that perpetuates some of this, just this frustration
Sure.
and just, even sadness and desperation a lot of times that these families feel because they're reading on these blogs and it's like, oh well, this mom did this or this mom did that, or I'm not doing enough. And it just really kind of perpetuates, I think, that view that it's all on them, particularly the moms that are breastfeeding. I think it's a challenge. So
Oh,
I
for
think
sure.
just
Yeah.
having that opportunity to interact with a provider that knows sort of the science behind it and not necessarily just anecdotal stories and things like that. Not to minimize the benefit of having a peer group that understands what you're going through. I think that's huge too. But sometimes it makes you almost feel a little more isolated and hard on yourself, I think, too.
Oh,
So
for sure. Yeah. And you'll try anything, like you said, to make things better.
yes,
Even if you disagree
definitely.
that it worked for one person, well, it could work
Yep.
for me, so I better try it. And it's going to be really
Yep.
hard, but gotta try it. It's just really hard to be a
Yep.
parent with the internet, because you're not
Absolutely.
just secluded and oh, I guess that must be normal.
Yes.
That's what my kid's doing,
Yes.
and it's just
Oh,
too
for
many people that
sure.
you can poll and find out what they're doing. What about
Yes,
let's shift gears a
absolutely.
little bit and talk about family history with food
Hmm.
allergies. Now,
Yeah.
let's say a parent, a mom or a dad has a food allergy. Is there anything in particular that we need to do in terms of avoiding or making sure that the child is exposed to help keep them safe and
Mhm.
prevent the allergy in our child?
Yep, it's a great question. It comes up all the time. So
Right.
this completely goes back to that risk versus benefit conversation. So there is a little bit of an increased risk if you have a family history for sure.
Okay.
It's not as dramatic as you would think. And really, the guidelines and the evidence suggest that we should not test
Okay.
prior to introduction.
Okay.
So like if you have a child, say, for sake of argument, like we're talking about those early introduction kind of infants, so a 4 to 6 month old, maybe older brother has a peanut allergy or mom has a peanut allergy or something. That specific risk factor is not significant enough or doesn't increase the risk enough to test prior to introduction. And
Okay.
the reason is kind of interesting. So if you have a family member with food allergy, you are more likely to have a positive test,
Okay.
but you're not necessarily that much more likely to have an allergy. So there is a little bit of a difference between positive testing and true allergy. So at least 30% of the population we know has positive food testing, even though they're not
Sure.
actually allergic to the food, which is just a
Sure.
limitation of that type of testing. And so the risk that you run is that you have this kiddo that maybe is at a little bit of increased risk of a food allergy because of family history. We test them, and there's a pretty decent chance that they have a positive test that may not actually be
Right.
positive. And then we end up avoiding the food based on that positive test because we just don't know for sure.
Right.
And then we create a food allergy because of that
Mm.
avoidance. So that's the big concern. And so I think ultimately the best approach is to try to introduce the food without testing,
Okay.
which is absolutely terrifying for these families.
Sure.
It's difficult for anyone introducing a food that's new for the first time that's potentially allergenic. But when you've got families that have had experience with past reactions, that's even scarier. So I think it's a delicate issue, and I would say, generally speaking, that individual child that we're talking about introducing to clearly would benefit more from just having the food introduced versus testing
Gotcha.
first because of that risk of falsely labeling them with allergy. But you also have to weigh, the risks to the family and the distress and things like that to the family. So I see, and I usually tell people, this is a very complicated conversation to have,
Right.
especially in like a primary care setting. So I'm happy to see these patients if they're like, I just don't feel comfortable. I want to talk about this more. I want to figure this out. Talk about the pros and cons. Like, do we test? Do we not? And honestly,
Right.
sometimes when I see these families, we end up testing because we just decide kind of as a group collectively that that's the better approach in this situation. And we know that there's a potential that we might have a false positive test. We might have
Right.
to do further testing, which could include blood testing and possibly even food challenges where
Sure.
we
Sure.
introduce the food for the first time in the office. But there's always that risk that we falsely label that child with a food allergy they don't have. And so it is tricky for sure. And then I think the other thing that comes up is, you've got families that are like, yep, I'm willing, we're going to introduce it. We understand that's the best thing for this particular child, but how do you keep the other family members safe?
Right. You don't want them
While
to
that
accidentally
food
get
is,
exposed.
yeah, exactly. So you have to be cautious about that. And I think, just, for peanut, for example, I mean, say you've got what comes up a lot is, maybe you have a toddler, a 2, 3, 4 year old, and then you have a baby and you want to introduce it to the younger sibling. If that toddler's in daycare or could go, goes to visit grandma or, has some time away from the house, that's a great time to go ahead and try to feed it to the infant. Or just, keeping the toddler, in a separate seat at the table and making sure the utensils aren't being used by both kids. And I mean, just
Right.
taking some extra precautions like that it is safe to do that at home. They aren't going to certainly react just by being next to their sibling having the food. They would
Gotcha.
have to come into direct contact with it. So we kind of talk about the nuances of all of that. But I would say, generally speaking, if we can avoid testing first and just introduce the food, that's going to be the lowest risk of falsely labeling that child with a food allergy and give them that benefit of having it in their diet and reducing the risk of food allergy. So,
Well, I like how you said there too. Again, we're balancing the risks, the risk of over
mhm.
testing and over diagnosing them, and then they
Yep.
don't ever get exposed, and then they do develop an allergy, versus the lower
Yep.
risk of them also having it as well. So it's again balancing those risks, which just makes
Yep.
pediatrics fun for me because I
Yes.
get to sit and think about those things. If it was just all like you
Yes.
just plug it into a computer program and it
Yep.
tells you the answer, well, maybe in a couple
Yep.
hundred years that'll be the case, but at least for right now, it
Yeah.
requires a little nuance and thinking and talking
Absolutely.
through and sharing that conversation with the family so that everybody's on the same page and you're not just
Yep.
forcing them to do something that they don't want to do or that they're distressed about, and
Yeah,
providing
absolutely.
that reassurance. So well, this has been a fantastic conversation, and I think it's added a lot and hopefully relieved a lot of people's worry about food allergies, especially in that first year of life when we're introducing foods and we're hearing about all these scary things on the internet and we want to do what's right for our child.
Yeah.
Um,
Yep.
if people want to see you in the office and get your opinion, you're at Boystown in Omaha,
Yep.
Nebraska, and I'll make sure and put the information so that they can find you in the show notes for this episode. Thank you so much, Dr. Hanson. It's just been such a pleasure, and I know that you're really busy with your clinical practice and it's Food Allergy Awareness Month and your
Yep.
family and everything like that. So I so appreciate your time.
Yeah, absolutely. Thank you so much for the opportunity. It's one of my favorite topics to talk about. So thank
Awesome.
you. I
I can tell
appreciate
you
it.
really, I mean, you make it very clear and we talk about the risks and the benefits of everything. So I love that. Thank you so much.
Yeah, thank you.
Thanks for watching. If you like this video, will you hit the thumbs up button and subscribe so you don't miss any future videos that I put out? And if you'd like to learn more or watch another video, you can click right over here to keep going. Have a good day. Keep up the good work.